That brings us to our 7 Up Front tonight and where we stand from the perspective of the state's top doctor. So joining us live tonight is Dr. Natasha Bagdasarian, Chief Medical Executive for the Michigan Department of Health and Human Services. Thank you for being with us tonight, Doctor.
Thank you for having me on.
Let's start with the overview of the numbers. It appears to be they're trending in the right direction. Have we turned the corner?
Things are absolutely trending in the right direction, and things seem to be moving in the right direction across the state. A couple of weeks ago, we had been very cautiously optimistic about how things looked in Southeast Michigan, but things are really looking good statewide right now. It doesn't mean that we're out of the woods, but it does mean that things are trending the way we want them to for all of the metrics we follow. That's case rates, positivity, and percentage of COVID patients in the hospital.
And that is so good to hear you say. Where do we go from here? Are you seeing anything, any modeling projections for what the spring might look like? Could we see changes in safety protocols like masking up in public?
I think we're definitely looking forward now. For the state of Michigan, it's been a very tough few months. We really saw our Delta surge and our Omicron surge back to back. And so this was a very tricky time. We were already at a place with very high hospitalizations when Omicron hit us. And we did do some modeling a few weeks ago that showed us we would peak with Omicron at the end of January, which is really what we saw happen. So our modeling was quite good. And that tells us that we can use the same types of predictions going forward. So I think that now across the state, we're doing a lot of forward thinking, a lot of forward looking as to what the spring could look like. And of course, we'll need to pay attention to other variants that we see across the country and across the world. We'll need to pay attention to what's happening with weather trends, with patterns in other states. But all of those factors go into future modeling and will really show us how Michigan looks in the upcoming months.
Well, we have been hearing more about that subvariant of Omicron when you talk about those variants. Its ability to evade testing. What can you tell us more about that, and has it been detected here in Michigan?
We're closely following our variants here in Michigan, and we're doing a lot of sequencing, a lot of genetic sequencing. One of the problems is that it does take time to get those sequencing results back. It takes over a week to get those results back. So what we see is really telling us about what happened in the past. But we're following those trends very carefully. We are not only looking at testing from individuals around the state, but we also have a lot of predictive models that use data from other states as well. So we're keeping a close eye on things, and our goal is to really identify problems before they arise and alert the public. So if we do detect a variant that we're concerned about, that we're concerned will have implications on breakthrough cases, on testing, our goal is to let the public know ahead of time.
And then what can we do to help prevent future variants and surges?
Well, the biggest thing we can do is stop transmission from occurring. Mutations occur every time this virus gets a chance to spread. And so the more that we can stop spread from happening, the better it is, not just for us here in Michigan, but really for the world. And so what we're asking is for individuals to use all the tools we have just to stop spread as much as possible. Vaccines are the pillar. So we know that vaccines and boosters have been incredibly effective against preventing those severe outcomes, even from Omicron. And then not only vaccines, but we also have our mitigation strategies that have been effective throughout, things like masking and distancing, and testing, early testing whenever people have symptoms, whenever they've been exposed, or before any big unmasked gatherings. So if we use those same strategies, we can prevent transmission and prevent further variants from developing. We also have therapeutics now, which are a big step forward, a tool that we didn't have just a few weeks ago, a few months ago. And our oral antiviral therapeutics are really effective at stopping severe outcomes and death. So we're trying to use all of those tools we have to prevent further surges and to prevent further negative consequences for our population.
And that oral you're referring to is the medicine that you've been working on to take in pill form.
Absolutely. We have 2 oral antiviral medications, and they're now available statewide. So our message to individuals who are testing positive, especially if you think you might be in a high-risk group, is to talk to your doctor about whether you qualify for one of these medications.
All right, well, Dr. Bagdasarian, appreciate your time as always. Thank you for the update.
Thanks for having me on.